Welcome back to the Breakfast Show 2. Joining me today are Williams and Dennis Gade from Rural Health in Southern Illinois. Thanks so much for being here with me, guys, this morning. First, tell me what you guys do and what you guys specialize at Rural Health.
Yeah, thanks for having us. I'll start with myself. I'm Erica Williams, as she introduced me. I'm a psychiatric nurse practitioner at Rural Health, and then I'm also certified in addiction medicine. And so I kind of split my time 50-50 between mental health and substance use disorders, treating people with substance use, primarily MOUD, which is medications for opiate use disorders.
Amazing. And Dennis?
And I'm Dennis, one of the social workers at Rural Health. I'm also a state licensed addiction counselor for the state of Illinois. Specializing in opioid addiction, of course.
And so opioids, that's going to be our main topic today. I know that there is an opioid crisis going on right now. And what does that look like in Southern Illinois? What are you guys seeing with opioids in Southern Illinois?
I think, the picture in Southern Illinois kind of mimics the national picture, and to call it a crisis even, I feel like is a little underwhelming for what it truly is. So, unintentional overdoses are the leading cause of accidental deaths, unintentional deaths in the United States. So, I think if you go out on the street and you ask people and you say, hey, if you had to think about what killed people more in the United States accidentally, they would say gun violence or automobile accidents. That's just not the case. It's unintentional overdoses. And there are things that we can do to prevent it, and that's what we're working towards locally. We're seeing a lot of pressed pills right now, which are pills that are made to look like one thing, but actually most of them contain fentanyl. That's leading to a lot of the overdose deaths that we're seeing locally. So, you may think that you're getting a Xanax or an Adderall, something from a friend that maybe had a prescription. In reality, it's fentanyl, and someone who's naive to that or even doesn't anticipate what they're taking and may take extra, that's a fatal consequence. So
yeah, and so then with opioids, some of these opioids, they are prescribed to people. Are you guys seeing that people are abusing the prescription, or what are you kind of seeing? Are people getting them just off the streets and using them? What does that look like?
So what we deal with mostly in the MOUD program is people who are at a stage in their recovery where they're ready to kind of get help and they're acknowledging that they have a problem. And so often, from what I've seen anecdotally, is these are people who are prescribed opiates initially, in a reasonable quantity for a dental procedure or chronic pain, and then they find themselves needing more and more and more, and that kind of leads down that slope of now we're buying things on the streets and we're using them inappropriately. And that can range anywhere from someone who is taking it as prescribed but feels like it's kind of out of control to people taking 60, 70, 80 oxycodone a day. And then, when they can't get that, then they do turn to the streets. They will look for those pills on the streets. And that's when we get into the fentanyl, the heroines. Your synthetic opiates are a huge problem right now.
Yeah. And that's the vast majority of cases. There are people that started with legal, legitimate prescriptions, usually from work injuries and things like that. And then usually what we're kind of running into is they're clamping down a lot on prescribing habits, which probably needs to happen, but then people have nowhere else to turn. So they turn to the streets, and typically street drugs become a cheaper alternative, something like heroin or even fentanyl at this point.
And so then would you guys say that mental health plays a factor in opioids?
Absolutely, 100%. So we call those co-occurring disorders. So a person with a substance use disorder can have what's called a co-occurring disorder, which could be depression, anxiety, ADHD, bipolar disorder, some of the really common ones, insomnia, huge, especially depending on the substance. And so mental health often, it can be a consequence of substance use, and it also can be a cause of substance use. So we have several patients who come in, they're in a really dark spot in their life. Addiction is probably the most isolating disease process out there, right? So when your neighbor gets cancer, or someone you grew up with gets a life-limiting disease, everyone kind of rallies around them, right? But addiction is the ugly disease no one really wants to talk about. And often persons with substance use kind of alienate their families and they alienate their friends because people have to set boundaries, and that's okay. But then that becomes more isolating, and that leads to more depression, more anxiety, in turn more substance use, maybe adding other substances to try to cope, like alcohol or whatever it is. So definitely 100% very linked.
Yeah, definitely is. And it's interesting that this comes up because in the field that I'm in, it's true almost across the board. Where you find one, you're typically the other, whether it's mental health or substance use. there's been a big debate on kind of which came first, like a chicken or the egg kind of thing, but we found that treating them both at the same time is the most effective way to go. And I was just at a 2-day addictions conference in Mount Vernon, Illinois last week, and this actually came up. And one of the things that they said that just fascinated me was if you take all the hospitals, health clinics across the United States, and so anybody that walks into them on a daily basis, up to 50% of people meet criteria for one of those 3 things, either a depressive disorder, anxiety disorder, or a substance use disorder. But only about 1.5% to 3% actually get treatment for that. It's a really low number as far as that goes. So, and kind of like what Erica said, there's just that huge stigma attached to the disease of addiction, where it maybe wouldn't be with other health issues. So.
It's definitely a conversation that we need to keep having and need to keep discussing so that we can end this, epidemic, because it's a fatal one and we don't want to see that anymore. Guys, thank you so much for joining me on The Breakfast Show and talking a little bit about this. We'll be right back in just a few.